Hello, this is Jim Rickards. Along with my partner Brett Williams, we'd like to present to you the culmination of our semester-long research we performed for the MGT 545 class. The topic of our presentation is analysis of a unique and novel teledermatology platform, Dermio. Before getting into the presentation, I'd like to give you a little bit of background as to where the idea for this project came from. Several months ago, I was approached by a physician colleague of mine, Dr. David Soleimani, who's an actively practicing dermatologist in the Chicagoland area. Dr. Soleimani had the vision to create an app-based teledermatology platform that he could use for delivering dermatological services to his patients and then possibly expand into a business. Essentially what it was, or is an app which one can download to an iPhone or Android compatible device, or also just use over any internet browser. And what that platform does is allow one to take a picture of a skin condition. This can be either a patient or provider taking a picture of the condition, provide some basic clinical history, upload this to a central database, and then allow a dermatologist to view the image as well as review the clinical history in a HIPAA secure and compliant platform. After reviewing all this data, the dermatologist can then make a diagnosis and then prescribe a treatment. Either prescribe the treatment to the patient or provider directly, or call it into a pharmacy or send it electronically to a pharmacy. So basically, Dr. Soleimani was wanting me to take a look at this app and see what I thought of it, and try to give him some advice as to how it could be unrolled on a larger scale and developed. I thought this class would be a great opportunity to review this potential product and service. So with that in mind, we've conducted essentially a three-part analysis for this project. One, we've looked at the current traditional dermatology landscape in the U.S. Two, we performed a SWOT analysis of the teledermatology realm, looking at how Dermio might fit into it. And three, we've tried to come up with some scenarios and ideas as to how Dermio could be rolled out into the teledermatology space. Who might purchase Dermio? Would it be a provider or patient? Or would it be a health care plan? What types of pricing structures need to be in place in order to make Dermio not only financially viable but also competitive in an increasingly crowded space? And thirdly, of course, regulatory issues. What types of barriers would Dermio face as far as HIPAA regulations or FDA regulations? So with that, we bring you an analysis of a unique and novel teledermatology platform, Dermio. So we'll start our discussion on the current traditional dermatology marketplace in the U.S. First off, who are dermatologists? Well, these are physicians, individuals with an MD or DO degree, who have typically completed a 4 to 5 year postgraduate residency and possibly fellowship program in order to become board certified dermatologists. So what this means is basically after somebody graduates from high school, they're looking at another 13 to 14 years of training until they can actually practice dermatology. It's this large amount of training, this huge time span, that is in part contributing to the fact that we're currently facing a shortage of dermatologists in the United States. So what do dermatologists do? Well, quite simply, they diagnose disorders of the skin, hair, and nails, as well as oversee and perform surgeries and cosmetic treatments, as well as aid in the formulation of pharmaceutical and cosmetic products. What does the U.S. dermatology market landscape currently look like? Well, today there are an estimated 9,600 dermatologists in the U.S. About 8,000 of those dermatologists are in group practices. Around 65% of all dermatology practices focus on medical treatments, with about 25% focusing only on surgery. This last piece of information is important to keep in mind because it's that 65% of all dermatology practices, over half of all practice in the U.S., that focus on just the medical or the diagnostic aspects of dermatology, which are important to teledermatology. Those 25% that only focus on procedures such as surgeries or injections really aren't applicable to the teledermatology marketplace, since by its very nature, a teledermatology platform does not typically involve physical contact or interaction with the patient as is necessary with these practices focusing on surgery. And interestingly, in the US, there is currently a shortage of dermatologists. This shortage is predicted to last into the foreseeable future, as well as to become exacerbated due to a variety of factors. While there was somewhat of a decreased demand for dermatological services during the recession, the economic recovery combined with the aging population is driving a resurgence for dermatological services. This includes both cosmetic services as well as diagnostic services. Of note, it's interesting that approximately 42% of all dermatology patients are over the age of 60, and approximately 68% of all of them are over the ages of 40. And it's typically when individuals start to reach the age of 40 and above, they start suffering more dermatologically related issues, especially those such as skin cancer. So it's this growing segment of the population which is contributing to the increased need of dermatologists in our workforce. However, there is going to be a persistent shortage of them in the foreseeable future. So what about healthcare reform in dermatology? Well, PPACA, or the Patient Protection and Affordable Care Act, will probably have both positive and negative effects on the dermatology industry. Delivery and reimbursement of dermatology services will remain in the spotlight as PPACA is implemented and healthcare reform continues. By 2017, under the current healthcare reform legislation, there's going to be a predicted 36 million more Americans with some type of insurance coverage. This is due to a combination of Medicaid expansion, development of state exchanges, and individual mandates. With this, a larger number of individuals are going to be receiving primary care, and with those individuals receiving increased primary care, there's going to be an increased diagnosis of skin conditions for which individuals are referred to by their primary care providers. Interestingly, dermatologists account for only 1% of the U.S. physician population, but comprise nearly 4% of overall Medicare expenditures. Additionally, skin cancer has become the 16th most costly Medicare diagnosis, accounting for approximately $2.9 billion annually. So we can see that the number of covered individuals will be increasing, and those with actual conditions needing treatment will be increasing under healthcare reform. But along with this, healthcare reform is going to be mandating increased payments to primary care providers, which could negatively impact specialty providers such as dermatologists. So we can see that increased volume and increased numbers of skin conditions such as malignancies or skin cancers could help dermatologists, but this is going to be coupled with regulators and health care payers' efforts to decrease reimbursements, especially such as dermatologists, in favor of reimbursing for primary care specialties. So let's take a little bit closer look at the dermatologist shortage in the U.S. I think this is critically important to talk about because it really is this shortage that's driving the need to change the way dermatology is performed in the U.S. Dermatology really cries out for a disruptive innovation or solution in order to ensure that it can meet the needs of growing patient populations that are covered with insurance, as well as who are facing increasing amounts of skin disorders. With this firm understanding of the shortage, I think it really will highlight the fact that a platform such as Dermio not only is unique and novel and kind of technically exciting, but really is almost essential to adopt in order to meet the needs of the U.S. population. So in the bottom right corner here, we can see visually depicted the shortage of dermatologists in the U.S. We can see that in the year about 2005, there was a peak number of dermatologists per 100,000 individuals in the U.S. population at about 3.5. Then starting in 2010, the number of dermatologists per 100,000 people started declining and is projected to continue to decline in the near future. So why is there this shortage? Well, as I mentioned at the outset of the program, it's in part driven by the fact that it just takes a long time to train dermatologists. Finding people willing to go through that amount of training, that 13 to 14 to 15 years after high school, is difficult. Additionally, the number of training spots is very limited. The number of positions available in the U.S. to train dermatologists has been relatively static for over a decade. Some references cite there being only approximately 32 new dermatology residency positions offered in the year 2012. Additionally, the current physician population in the U.S. is aging. Over 50% of all physicians in the U.S. are over the age of 50. And oftentimes those over the age of 50 are working a lot less. They're only working part-time. So we have an aging physician population, not a lot of new physicians coming out of practice, and not a lot of opportunities for those physicians in training to become dermatologists. So we essentially have this training bottleneck and actually decreasing number of physicians. So the bottle actually has a small hole in it and is creating some challenges in the delivery system currently. Early in the presentation, I alluded to the fact that a disruptive solution such as Dermio or a teledermatology platform could potentially help address or alleviate some of the shortage of dermatologists in the U.S. Is there anything else being done about this? Well, some dermatologists are hiring non-physician clinicians such as physician's assistants or nurse practitioners to provide greater number of patient services. Additionally, some family practice residency programs are actually starting one-year fellowships which train family practitioners to act somewhat like dermatologists to provide skincare services to patients. However, these efforts fall short of what's needed to address the growing patient population with skin disorders which need to be seen by dermatologists. So when we look at the effect of the shortage of dermatologists on patients and their access to care, it becomes apparent that the current efforts to address this shortage aren't working and that something else needs to be done. Currently, the mean wait time for new patient appointments on average in the U.S. is 36 calendar days. In some places, this ranges up to around 120 days. Additionally, about half of all dermatologists feel they need more dermatologists in their practices. Reported need for medical and general dermatologists is far more acute than dermatologists, subspecialists performing procedures. This is particularly relevant to teledermatology such as Dermio, which potentially act to increase the efficiency at which dermatology is practiced, as well as increase the volume of patients seen per day by dermatologists. In summary, survey data indicates that wait times, physician perception, and use of physician extenders, as well as searches for new employees and experience of recent graduates entering the workforce, indicate that there is an inadequate supply of dermatologists to meet local demands in many areas. So in summary, the current delivery system faces many challenges which could potentially become opportunities for a disruptive solution such as Dermio. We see there's limited access to underserved populations, such as in rural communities. There's long wait times for appointments. With that, there's also delayed turnaround time from diagnosis to treatment. Oftentimes, this is exacerbated by the fact that the very physical limitations of the way in which dermatology practices somewhat forces dermatologists to see a limited number of patients. You can only move so many people through a physical office in a day. Additionally, there's increasing costs in the practice of medicine, such as increasing liability insurance, increasing wages for employees, with decreasing reimbursements for specialists in lieu of more payments going out to primary care providers. So with this in mind, the environment seems ripe for a disruptive solution and opportunities such as dermatology. So let's switch gears and talk a little bit about what telemedicine is. Telemedicine is the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health status. It includes a variety of applications and services, such as using two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. Essentially, there's two types of telemedicine. One is synchronous telemedicine, which involves live, two-way interactive communication by video or voice. It often presents scheduling challenges similar to traditional clinic appointments, and also presents greater technological challenges as well. With this type of telemedicine, it's important to realize that it's difficult to coordinate individuals across time and place to meet and talk. More promising is the second broad category of telemedicine, which is called asynchronous or store and forward telemedicine. It gets around many of these issues. In asynchronous telemedicine, clinical information is collected and transmitted via email or web applications to a specialist or physician who can then review the data at a later time. This is more convenient for both patients and providers by eliminating the barrier of presence. So what are some advantages of telemedicine over traditionally delivered medical services? Well, improved access. Telemedicine can bring services to patients in distant locations that may not have local providers. Cost efficiencies. Reducing or containing the cost of healthcare is one of the most important reasons for funding and adopting telehealth technologies. Telemedicine has been shown to reduce the cost of healthcare and increase efficiency through better management of chronic diseases, shared health personnel staffing, reduced travel times, and fewer and shorter hospital stays. Improved quality. Studies have consistently shown that the quality of healthcare services delivered via telemedicine are as good as those given in traditional in-personal consultations. Additionally, telemedicine, specifically as it relates to teledermatology, offers a platform for more robust peer review of cases to ensure that all physicians are performing up to a standard of care. And finally, patient demand. Consumers want telemedicine. The greatest impact of telemedicine is on the patient, their family, and their community. Using telemedicine reduces travel time and other related stresses for patients. Such services offer patients access to providers that they might not be able to have available otherwise, as well as medical services without the need to travel long distances.